Okay, tip one, don't mind the pheasant. So we'll start off with some basic stretches rather than diving into some very sort of technical stuff and making too long a video. So let's say, for example, we've got some maybe suboccipital headache coming from the right back of your skull, coming up maybe up over here, around your eye. We've got a little bit of pain coming down the back here, difficulty looking to your left, and just a generally achy trap, and maybe between your shoulder blades on the right hand side as well. We'll use that as our standard example for this video. So a basic stretch to start with. If you take your right hand in this example and grip underneath your chair, take your left hand up and over and just sort of cup the back of your head on the right, and you're looking for an action that's going to lift a little bit and also pull over. We're going to get you to turn your head down and to your left knee, and using that lifting, cupping and pulling action, just gently pull your head over, and you should, with the anchoring of your right hand, feel a good upper trap and also levator scapula stretch. Don't push it beyond the point of pain. Just a comfortable stretch. Work with your tissues. Don't allow yourself to overstretch and cause yourself to go into more of a spasm. And just hold there just for a gentle short period. Ease off if you need to, and then go back into it. Exhaling a little bit will help you relax. Inhale and ease off. Exhale, pull back gently into the stretch. You're not really looking to yank your head over strongly, just looking to encourage some movement. And because you're lifting a little bit as well, you're trying to create a little bit of space in those facet joints on the right hand side of your neck. If they're getting fixated, locked down, hopefully you'll just gently start to encourage that movement to come back. Okay, so that's tip one. Look out for more. Thank you.